Have you had to get a prescription filled lately? We all rely on the pharmacy, hospital, or a doctor's appointment to take care of our health. Well, you may not know it, but the medication you need could be on the critical list. Some drugs actually bounce back and forth when it comes to availability. Medical teams don't know one day to the next if they will have the drugs needed to take care of you. More than 200 drugs nationwide have been in short supply for several years. Your medications are running low for a variety of reasons. Well, manufacturing and compliance issues, according to the Food and Drug Administration. A shortage of raw materials, another issue. And companies getting out of the generic business. And tonight's Living Better for Your Health special report, how the situation is forcing some tough decisions. Medical teams at Savannah hospitals are deep in the trenches. Their workload increased to handle a national drug shortage.
We're probably, putting anywhere from 10 to 20 hours of man hours trying to find different medications.
Memorial's pharmacy director Ken Josephchek says some are life-saving drugs.
We probably have about 40 drugs that we manage very closely.
Many are drugs they thought they would never have a problem getting. That list includes electrolytes, potassium chloride, and sodium bicarbonate, which is used to maintain an acid-base balance.
It's very important to us and our critical care patients especially.
So those crucial drugs are given to the patients most in need, and an alternative is used for patients not critical. The FDA blames the short supply of medicines on quality problems and drug companies deciding to stop making medicines. St. Joseph's Candler is also scrambling to fight the medication shortage. Employees work hard to track those drugs in short supply.
We have frequently had to make clinical decisions to substitute an available medication for one that might be originally prescribed by the physician because we simply were not able to get it.
Pharmacy Director Ray Maddox says the shortage is improving, but they still have difficulty getting key drugs like propofol. It's used to sedate patients for surgery.
A year or so ago you just about could not get it. We now can get it, but the problem is tomorrow we may try to order some more propofol and it be on back order or not able to be supplied in the quantities that we need.
Here's how they manage the crisis to ensure that the patient gets quality care.
We, depending upon the drug and the condition that's involved, for both nurses as well as our pharmacy staff, for specific drugs that we're having to substitute, have made printed materials and electronic information in our computer system that names the drug that's in short supply, the drug or drugs that we're going to be using in place of it, and the equivalent dose.
Another drug hard to get their hands on is leucovorin to treat cancer.
There have been some patients, I think on the outpatient side, where we've had to delay treatment because none of that drug was available.
It's a small pill. It's not a big pill, which is good for him to be able to swallow, and he just takes one a day. They all pretty much look the same. They just have different colors.
Sandra Diallo lives with desperate hope that she will be able to get the medication her son needs to get him through the day. 8-year-old Anthony has attention deficit disorder. He's been on Concerta for 4.5 years.
There was a time at one of the pharmacies that I put in the prescription. They said it would be ready that night. I went to go pick it up. It wasn't. They said it would be 3 or 4 days. They would give me a call, and I said, okay, I got a couple of pills at home, but I really, really need it because I only have 2 or 3 pills at home. And it turned into 15 days.
If Anthony were unable to get the medicine, it could lead to scary consequences.
If he were to go a couple of days without it, he gets social anxiety, would not be able to deal with that in the school and have a hard time functioning, as well as not be able to learn and do what he needs to do to be able to move on and be successful.
Since it's been so difficult to hunt down the medication, Sandra hopes the drug shortage will be resolved soon.
If maybe there were more options available for the medication so that they would be able to get them out quicker and get them out to everyone, because I do know several parents that have had issues.
Back at the hospitals, they keep working with what they have and looking forward to the day when there's a plentiful supply of all medications.
Probably for the first time in 5 or 6 years, we're starting to see a decreased number of new drug shortages every month. So that's the good news. The bad news is there's still a lot of drugs on that list.
It's important for patients in the community to know that all of the medical community, physicians, pharmacists, nurses, all of us are committed, highly committed to giving the highest quality of care in our community, even when we face difficulties with medications.
Now, to help prevent future shortages, the FDA Safety Innovation Act was actually passed recently. It requires drug manufacturers to inform the FDA when they are going to have those shortages. Meanwhile, Ray Maddox at St. Joseph's says that he's cautioning patients about actually going on the internet to find and buy an alternative source of a medication that might be in short supply. He says that can be dangerous.